are you saying that it's physically not possible for them to breastfeed, or they should not breastfeed if they're critically ill?
It's physically complicated to breastfeed, and there can be issues with medications, because if a critically ill woman is in a intensive care unit, you have a lot of problems, both with stimulating breast milk and with the type of medications you are giving. So it is not impossible to breastfeed. From my experience, it's not very easy to have an ICU unit that is aware of the will of mothers to breastfeed. And so usually it gets a bit complicated. But that doesn't mean that when she leaves intensive care unit, she's not able to make relactation. So induce the production of breast milk again if she's very willing. Okay. So there is this possibility. I don't know, you probably have lactation consultants or, I don't know, breastfeeding doctors in India too, so you can search for someone and to help, because they will need some help, but it's possible.
Okay, all right, okay. Okay, so this is an important question that I found in some of the groups on WhatsApp, mothers asking. It says, can we undergo C-section surgery if they are COVID positive and pregnant? Cesarean.
If they can, of course, you can do anything. There is no medical procedure that you cannot do because you are COVID positive. First of all, you don't have to have a C-section. And we can talk about why you may want to avoid a C-section if you want. But if you need a C-section, you can have it. And actually, the baby usually is born COVID-free most of the times from C-sections. If they get infected afterwards. So why? Yeah, afterwards, not inside. The COVID is not in the blood, so to say, it doesn't go through. So it's in the respiratory mostly, or gastrointestinal. C-sections have very precise indications, and they are a surgery. They are major surgery because the mother has to have anesthesia, and it's you have to cut the belly, so it's not a very simple thing. It's not a very dangerous procedure because we have made it less and less dangerous with times, so that's a good thing. But there is a reason why a child is born the way it's born, why we are made the way we are. So we have been knowing more and more about microbiota. I don't know if you heard about it. Yes. And the first encounter between the child and the mother's microbiome is during delivery. So delivery has a lot, the vaginal delivery has a lot of advantages. It's frightening when you think about it when you are a woman before you have it. Once you have it, then you realize it's not such a big deal. But in the first, when you think about, gosh, how is my body going to respond to this thing? It's frightening. But actually, if the process is done the most naturally possible, we have years of evolution that took us to the possibility of delivering vaginally, not such a difficult way. So there is some degree of pain, but if you are able to move and to put yourself in the position that you instinctively want, and you can do this in the hospital, you don't have to do that. It doesn't mean, because there's this kind of idea that if it is natural, it has to be in your home. And actually, it is more risky if it is at home, because if something happens, there is no one there to help. But what many countries do is they have midwives, and the doctor is called only if there is something that is not going on well. And that makes sense, because we as doctors, we are trained for difficult things, for severe things. So a normal birth is just annoying, like, what a bore. I mean, that must be something more interesting to be done. But the midwife is okay. They are trained for normal birth. So and it's perfect. And if something happens, you can call. And so if you can move around more freely and adopt the position you want, and no one is telling you when to push, and your body knows when to do it, the baby will come out much more easily. It will not be so traumatic on your body or on the child's body. And there's this squeezing that happens when the uterus contracts. It's also very important for the lung function, for the respiratory function. So it's not a bad thing to deliver vaginally if it is done in a respectful way, respectful in the sense of physiology.
Right.
So I would say don't let fear influence your decision of delivery, because there are advantages in vaginal delivery. Those advantages are then complemented by breastfeeding, because most of our microbiome will be also passed. We don't know very well this mechanism, but we know that the mother's microbiome goes through the breast milk to the child. And so the child has 80% of the microbiome like its mother. So our microbiomes of us are similar, more similar to our mother's microbiome than to our father's microbiome, which is quite an interesting thing.
Yes, very interesting fact. So yes, that was really interesting. Thank you. The next question is about vaccination. There's so much going on about vaccination. People are so scared. There's so much myth going around and hesitation, and also the vaccine, especially in India, the production is not able to match the supply. Yes, the supply is much lower than the demand size. So can breastfeeding mothers get vaccinated? And the follow-up question is, can pregnant women get vaccinated? If yes, when, and what should be the precautions? If no, then when can they get vaccinated?
So the pregnancy question is the most difficult one, because the vaccine is relatively young. This specific vaccine for COVID-19 is relatively young. The technology behind it is not that young. And that's important to say to people, because many people say, oh, this is just an experimental vaccine and we know nothing. No, it's not true. This both the research on COVID, not COVID, but on SARS-CoV-1, which was the SARS virus, the first one, is 17 years old. So we knew already that we had to use the spike protein because it had already been studied 17 years ago. And both technologies, both the vector, so there are two types, well, actually there are three types, because the Chinese vaccine is an inactivated virus, but the most common, do you have Sinovac in India?
No.
The Chinese? So you have the vector, I think, and the mRNA. Yeah. So there are these two technologies. One is the vector vaccine. So you have adenovirus, which is a common cold virus, where they inserted the DNA of the spike. And so as the virus is reproducing, it's also producing this protein, and our immune system is reacting to it. And then there is the mRNA, and that is really a different technology. What's like completely different. We never had a vaccine like that. And but it's also have been studied. I found articles with flu mRNA vaccines, and they were pretty safe. I don't know why they never evolved. They are from like 2016, I think, if I recall correctly. And actually, they were very effective. So it's a pity, because they were more effective than the usual flu vaccine. So maybe it's the future. So there's this very little nanoparticles with a genetic code that produces the spike. So it is, our immune system is more focused, because in the vector vaccine, you have a lot of antigens, and one of them is spike. In the mRNA, the only antigen is the spike. So maybe that's why it is a bit more, not much, but a little bit more effective, because it's not dispersed, it's focused. So this is one thing. They are, all of them, very safe. There were some concerns raised about the vector vaccine, which is, I think, the one you have most in India, because it's easier to conserve. At the temperature required is less low. So I think that's one of the reasons why India is using this vaccine.
Right.
Yes. There were some concerns raised with thrombotic cases. So women, especially young women who had this cerebral so they have thrombotic events with low thrombocytes. So it's like, but it is a very, very, very rare condition. And it's important to say this. It's really very, very rare. So it's not a reason. It's much more dangerous to have COVID than to have the vaccine. The risk, it's much, 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 much lower. It's more risky to take the pill than to have the COVID vaccine. So it's important to say this. Right. So about vaccines and pregnancy. The studies that were done were not done in pregnant women. So there was not a subpopulation of pregnant women. The information we had during the pre-commercialization was that the women that were pregnant without knowing or got pregnant without knowing didn't have any problem. So currently the recommendation is to get vaccinated. And the second trimester usually is the best. Actually, with a wave going on, the faster, the better. So don't wait. If you want to get vaccinated, get it right away. That's an important thing. First of all, it is not so. It doesn't seem to be a problem to be vaccinated during pregnancy, but it was not specifically studied yet. It will be. I think they will have shortly. We'll have data about that. But the recommendation is to discuss it with your health worker and consider doing it. Why? Because when you are pregnant and you get COVID, you can have a worse outcome than if you are not pregnant. So young people usually don't have such a severe COVID, especially if they are not obese, not diabetic, then no cardiovascular problems. So usually it is a mild thing. The worst thing sometimes is getting long COVID, not so much the disease itself.
Right.
But pregnant women have a higher risk of intensive care need, so severe disease. It's not a very high, but it is a higher need. And it's something, if you are pregnant, you're not going to go through that. Right? So first, really be careful with avoiding crowds, using masks, and being very correct with all the precaution measures, and consider getting vaccinated, because if you get COVID, there may be a severe disease. That's the first thing. Also, when you have COVID very near your delivery date, there is a higher risk of prematurity. It is not it's not that if you have COVID, you're going to have a premature baby. It's not like that. There's a percentage, a question of percentage. You have a little bit more risk of having a preterm childbirth. Right. And so you don't want stillbirths too. So you don't want that. So if you get the vaccine, you lower the risk of having these outcomes. So you should discuss it with your health worker, but I think you should consider it. With breastfeeding, there is no doubt. Just do it. Do it. Because there is no problem to the mother. There are antibodies in the breast milk that are probably protective to the child, and there is no vaccine to the child. So you will be protecting two people with one shot.
That's really reassuring.